Hello, everyone. Welcome. Okay, let me go ahead and get started. So, hi, everyone. My name is Michelle Jew. I'm the program coordinator of the Aspire program at Appeal. And I wanted to really welcome and thank you for coming to our webinar entitled Syndemic-How Mental Health, Healthy Eating, and Active Living and Tobacco really combine to create health problems. We're going to get started in about just a minute. So if you could just go to the next slide. All right, objectives. So understanding how mental health and physical health and wellness combine with other risk factors and chronic conditions to create a syndemic, engaging community-based organizations in promoting healthy behaviors, and supporting community wellness through your youth and advocacy and community engagement. And then we really want to create a sustained health behaviors through building capacity, strategies, and resources to help with engaging our youth in youth-led tobacco control efforts. And then finally, reducing the effects of syndemic on youth through advocacy of upstream industry initiatives for tobacco and food policy. Next slide. Here's the agenda, and I'll start with some housekeeping, and then we'll actually move through to the introduction of the webinar, presentations from our speakers, and then finally the Q&A panel discussion and closing. Next slide. Okay, and so before we get started, in just a minute, we will be doing starting the webinar piece. I actually want to go ahead and mention a few Zoom guidelines. This is a webinar format, and this actually means the audience mics are muted and that videos will be off during the whole webinar. I really encourage all of you to use the question and answer feature at the bottom of your screen and to ask the panelists if you have any other questions that you may have through the Q&A. Please feel free to use our chat function and features as a way to really leave comments, thoughts, or anything else that you might have for the whole audience. And this also goes to the panelists and audiences. And lastly, we really kindly ask that you complete the 5-minute survey that we actually email outwards. It's from our evaluator, Linda Bosma, so please keep a lookout for that. And our webinar will be recorded and it'll be available in about 2 weeks on our website at appealforhealth.org. Next slide. So today we have our featured panelists from our webinar. So Samara, she's the project manager of practice improvement at the National Council for Mental Wellbeing. Samara is a public health professional with more than 6 years experience in engaging community and government stakeholders in advancing public health initiatives aimed at improving community resiliency, closing mental health equity gaps, and increasing access to care. She currently serves as the project manager of practice improvement at the National Council for Mental Wellbeing. Next slide. And next up of our featured panelists, we also have Stacy Huamea. She's a clinical provider, registered dietitian and nutritionist, and she's also certified in diabetes education and care specialization. She is from Malama. It's a family medicine clinic. As a clinical provider for Malama, it's a native Hawaiian healthcare system for the Hawaiian Islands. Dr. Huamea has a passion for education. She has over 25 years experience throughout the state of Hawaii. And she is also a registered dietitian, nutritionist with an educational background in behavioral health, public health, and nutrition. She's licensed as a certified diabetes care and education specialist. Stacy is really going to provide us with preventative and therapeutic nutrition and lifestyle education, and she is passionate about individuals and groups with respect to a variety of cultures in Hawaii. Next slide. And we also have Alexandra Parks. She's the Vice President for Strategic Partnerships and Programs at Truth Initiative. Ms. Parks has 20 years of public health experience and working with local, state, and national organizations, and she helps to develop and implement numerous programs and initiatives. As the Vice President for Strategic Partnerships and Programs at Truth Initiative, she is responsible for cultivating and establishing partnerships across different sectors, including national stakeholders, youth-serving organizations, and community-based organizations, and other nonprofits that reach youth and priority populations. Next slide. We also have two featured guests for discussion and updates. So this is actually a follow-up webinar to one we had last year in May of 2021. And in that one, we've really focused on COVID, racism, and mental health, and how all of that, combines to create a syndemic. We had really great speakers, including Dr. Saul and Ms. Ng. And today they are here to really give us updates and to also help with the discussion pieces. Next slide. So find us on our socials. Next slide. What is a syndemic and the approach to health? A syndemic really involves two or more diseases that interact to worsen health outcomes. It includes consideration of how the wider environment, context, and other social, economic, and political factors contribute over time to mutually exacerbate negative outcomes. This was a term that was coined in the 90s by a singer to really describe the HIV epidemic. And how certain factors come together to really create this. We have also used these terms to describe the tobacco epidemic in Oceania and the Pacific Islands. And today we are really going to focus on how different factors and social determinants of health come together to create a syndemic. Okay, next slide. So how does this relate to each other? So we have our social determinants of health as an overarching piece, and then we have the mental and physical health pieces, chronic disease and COVID. So really looking at how COVID and how also other pieces are really impacting our health, and also commercial tobacco and how that really ties in. Okay, next slide. And so Appeal has worked with the community to strengthen our partnerships, navigate from social norm change through policy and programming initiatives. And so we have our guests here to really give us an update on how we can continue with AA and NHPI work. So first off, we'll have Dr. Saul. Next slide.
Great. Thank you so much, Michelle, for inviting me back. I am presenting on behalf of Dr. Janice So, who couldn't join today, as well as Adrian Bakong and Dale Manglang, who have been helpful and very instrumental in pushing us forward with some of these updated findings that I'll be sharing with you today. And I don't want to take up too much time because I'm so excited to hear from the featured speakers, but appreciate the time to give you some updates. So last year, Dr. So and I presented on syndemic of COVID, anti-Asian racism, and thinking about tobacco use. And so I'll be sharing some of our updated findings and connect you with this syndemic framework. Next slide. So as Michelle mentioned, one way of understanding the syndemic is these interrelated and overlapping health conditions that when they overlap and they can exacerbate health conditions. And as we think about our syndemic framework, we also consider the the epidemic of anti-Asian hate and discrimination. We also think about economic stressors and how in the context of COVID that has magnified and also interact with anti-Asian hate and discrimination, as well as health and mental health challenges to create kind of a magnified set of difficulties for Asian Americans in the context of COVID-19. And if you'll click again, Priya, this is within foundationally structural racism as a fundamental driver of all of these things, right? So that all of these three pieces occurred prior to COVID and were in place because of structural racism, that we didn't have enough linguistically and culturally appropriate healthcare systems to meet our community's needs, that bilingual, multilingual resources were not available to help and support economically stressed individuals. And as we move out of, hopefully, this syndemic, structural racism can fundamentally shape how well we are able to address and improve Asian American, but also Native Hawaiian, Pacific Islander, and other communities of color, our health and well-being. Next slide. This came out a little bit differently and very, very difficult to read. It's okay, no need to read this slide, except to say that what findings I am presenting to you are from a very large needs assessment project that we conducted between January and April of last year with actually over nearly 5,000 participants, about 3,700 Asian American and almost 1,300 Native Hawaiians and Pacific Islanders. And I'll just present findings from our Asian American sample. And this is actually our weighted sample that's been weighted to the Asian American population. So this slide is just meant to illustrate the vast diversity of Asian Americans that are reflected in these findings. Next slide. So using our weighted data, our study found that over 4% of Asian Americans reported coping with COVID-19 stressors through tobacco use. So this isn't tobacco use rates, but coping with tobacco use. So likely the tobacco use rates are higher. 13% reported coping with COVID-19 stress with alcohol use, and 4% reported coping with marijuana or CBD use. Next slide. We also inquired about discrimination experiences. So about 25% of Asian Americans reported discrimination due to race and ethnicity as a major stressor during COVID. About the same proportion reported facing discrimination as having an important impact on their family's life during the pandemic. And on average, Asian Americans report about 3.5 stressors. So these are we asked about a wide range of stressors, from discrimination to loss of income and jobs, to education disruptions, food insecurity, housing instability. So Asian Americans have been very impacted by the pandemic. Next slide. And I wanted to just provide a couple key findings that relate to tobacco, alcohol, and marijuana use. So our findings suggest that the number of COVID stressors is associated with higher odds of use of tobacco, alcohol, and marijuana use, even after accounting for discrimination and sociodemographic factors, and that the more stress people experience across different domains of their life, the higher their odds of using multiple substances. We also found that awareness of COVID-related racism, which some people can think about as vicarious racism, so not just personal direct impact of racism, but also understanding that this is happening on a widespread level to Asian Americans, is associated with higher odds of marijuana and CBD use as a means of coping with stress. But kind of more broadly, this is just a snippet of our large scale, our large study, which also looked at health and mental health impacts. Priya, next slide. We really want to hammer home that discrimination and other stressors have impacted health and mental health for Asian Americans. So our findings suggest that discrimination and stressors do impact how people use substances to cope on obviously discrimination is one piece, but then tacked onto discrimination, overlapping with discrimination, are all the other stressors: economic, health, access, healthcare access, education, or food access. These are all interrelated stressors that impact health and mental health. So in other studies that have come out of our broad study, we have found that discrimination predicts mental health outcomes for Asian Americans and for Pacific Islanders. So we really do want to keep pushing the syndemic lens to better understand and address how COVID has impacted health and health behaviors for our communities. So I will stop there, but happy to entertain questions over chat.
Thank you, Dr. Saul. Next up, we have Ms. Sherry Ng. She'll also be giving us a little bit more information from the Quitlines piece.
Hello, everyone. Thank you so much for inviting ASQ to join this webinar. I'm really happy to share some of the ASQ updates and the services with all of you. And if there's any questions after our update, feel free to send your questions. And I'm also very excited to hear all the other speakers to present the topics that's definitely related to the clients that we are serving here in the United States and at ASQ. So can you go to the next slide, please? In ASQ, it's actually fun. Oh, I'm so sorry. I don't have a title page. Can you go back? Sorry about that. So for us, we are actually funded by CDC in 2012 to provide services to people who live in the United States and speak Chinese, Korean, and Vietnamese. And for those tobacco users, we have found that they have very high smoking prevalence, and they also facing the language barriers. So that's why we feel that we think that in-language services is really important to these populations. So since 2012, we have provided the services to all these languages people. And besides providing the counseling over the phone, we also offer services to people who are actually seeking services to help others. So we do have proxy clients, services, materials, and last year we started our in-language texting service to support any quit attempts. People, they are not ready to quit yet. They just wanted to know a little bit about ASQ. They wanted to find out what are the strategies. They are always welcome to Texas. Can you go to the next slide? And this slide will give you an overview about the ASQ services. And since we are providing in-language service, and our names will also translated into the different languages, and these are the official names of ASQ languages, and then there are the key phrases that they can send it to us, and then they can receive in-language support text according to what kind of language that they use. So this was just started last year. So if you know anyone who might just wanted to see what is ASQ, feel free to have them text us anything. Next slide. And like I mentioned, besides the tobacco counselings, we also offer free nicotine patches to any eligible participants. So if they are eligible, they will get 2 weeks supply of the nicotine patches from ASQ, and they don't need to go to their pharmacy store to get it themselves. We will send it to them directly, and all the services, it's free, and it's nationwide, so it doesn't matter where they live, and so they can enroll themselves online as well. Next slide. And I also wanted to share some of the socio-demographic information that we have observed throughout this year among our ASQ clients. I know that like Asian cultures has a pretty big populations and different cultures. And for the populations that we serve, it's mostly Chinese, Korean, Vietnamese, although it's not like entire Asian populations, but I hope that the information that I'm going to share can help all of us to have a little bit information, understanding about some of the Asian cultures and see how we can reach out to them, talk to them, or provide a service to them. So through as of yesterday, actually as of today, we have served over 19,000 people in the United States that includes all the different languages. And you can see that Korean has the most participations among, all the other two languages. So they have the highest participations, which means that we do have the highest number of the Korean callers or the people who are calling to either get service for themselves or they're getting information to help others to quit. And then for all the tobacco users, over 85% of them, they are actually opting for counseling service. And we also send over 80% of the patches to the eligible smokers. And of course, 90 majority of our participants, they are smokers. And there, it's like less than 10% of the people that they are calling and getting the information for all the other, their loved ones, their friends or families or coworkers to quit smoking. Next slide. And I'm just going to share the different languages, participants, what are their characteristics, the socio-demographic, and it's a lot of information. I think I'm just going to highlight some of the things that in each of these language that is, I think it's important for us to keep in mind. As you can see that for the Chinese participants, majority of them identify as males aged between 44 to 65 years old. And then close to 40% of our clients, they heard of ASQ through media. And across all three languages, actually Chinese clients have the highest referral coming from the healthcare providers category. They have close to 20% of them versus, Korean, they have about 5%, and then Vietnamese populations, about 10% of them actually got referred to ASQ from the healthcare providers. So keep in mind that Chinese clients are likely to make quit attempts or they would take some actions to seek help to quit through the healthcare providers. Next slide. We're going to look at the Korean participants. And then over 50% of our Korean participants, they heard of ASQ via traditional media. And then next to it, about 16% of them, they are referred by their friends or family members. So it could be they got our number or they have received the texting message or some of the online information from their friends. And then quite a majority of the Korean clients have no insurance, or majority of them, they are actually receiving the public insurance, for example, Medi-Cal, Medicare. Those are majority of the Korean clients. And then the other things that I wanted to point out here is among all three languages, Korean clients actually have the highest percentage of receiving educations more than high school. So this is the distinctive difference between all three languages group. And then for the next slide, it's about the Vietnamese clients, and majority of them, over 50% of them, they heard of ASQ through media. Mostly, if I break it down, the media sections, radio works the best to reach out to the Vietnamese clients. And then the second highest source is coming from friends or family. And among all three languages group, Vietnamese clients actually has the highest heard about source in the internet and social media category. So for Vietnamese, you can see that close to 13% of them, they heard about us through the internet source. And then Korean, there are about 10%, and in Chinese populations, they heard of ASQ through internet or the social media is about 6%. And then if I just look at it since the pandemic started, I can see that it took a tremendous increase for the internet and social media heard about among the Vietnamese category. And so this is something that I think is useful, especially for us to plan about the outreach strategies and how to, plan for our community events and things like that. Regarding the insurance among the Vietnamese clients, it seems like it's pretty even. And so especially for the public insurance and other types of insurance, they shared about the similar percentage of it. So it's a really quick snapshot about the client profiles. So I hope that this information can give you some ideas about how to plan for strategies, outreach ways, and community engagement and the different things. And the next slide, the Father's Day is coming, and as we all know, the Asians, they really treasure about the core values to, spend time with a family. So we do created some of the social media posts, and we posted it on our ASQ Facebook page. And if you are interested, you can visit the ASQ Facebook, and you can forward these, social media posts to your clients or anyone that they're interested in. So thank you so much. I look forward to hearing from the speakers.
Appreciated, Sherry. Yeah, that was a really great update from our last webinar about the syndemic pieces and all of the cultural work and data disaggregation collections that we're looking at for tobacco. Now I would really like to turn our attention over to Samara. She's going to go over how mental health really impacts all of this. And again, syndemic is what happens when you have multiple interrelated epidemics happening at the same time. Okay, Samara.
Thank you, Michelle, Dr. Saul, and Ms. Ng for grounding us in today's webinar topic and giving those wonderful updates. Hello again, everybody. My name is Samara, and I'll be talking about mental health, tobacco use, and how it intertwines with chronic disease, contributing to a syndemic. So before we begin, next slide. I'd like to share some definitions with you all so that we can start to share a common language. While mental health and wellness have a different meaning for everyone based on their lived experience, when I refer to mental health or mental well-being today, I'll be speaking to an individual's or a community's ability to thrive, live, love, laugh, play, and pray, regardless of experiencing a mental health or substance use challenge. In addition, any mention in my presentation that when I refer to tobacco is strictly referring to commercial tobacco use and not the sacred and traditional use of tobacco. Next slide. I also want to frame this work around health disparities and health equity, really understanding the root causes and drivers of health and illness. As we know, smoking is one of the main risk factors for a host of chronic diseases, including cancer. So one of the things we're asking ourselves is why do individuals smoke and why does this disparity exist? We know that our health is determined by other factors in addition to our own behaviors, often outside of our locus of control, things like the environment, access to care, and community and societal factors. And without considering these other factors, we're left somewhat lacking in our approach when addressing these disparities. So we must consider, from a systems perspective, what puts people at risk and how can we craft interventions in response to those drivers. Next slide. The overall rate of cigarette smoking among adults has been falling steadily over the decades, which is great news. It's one of the largest public health achievements. But people with mental illnesses have been neglected. Approximately 25% of individuals in this country experience a mental health or substance use challenge, but they actually make up 40% of all commercial cigarettes smoked. This can be attributed to a lot of predatory practices by the tobacco industry, which include targeted advertisements. So back in the day, they used to say that cigarettes were a way for people to calm down anxiety, or you might see ads where it was seen as like a cool thing in parties. Other things include providing free or cheap cigarettes to psychiatric clinics, intentional blocking of smoke-free facilities, funding research that actually perpetuates myth that quitting would be too stressful for a person and negatively impact their mental health. There's also high rates of trauma and ACEs in this population, and this impacts both long-term mental health, but also physical health as well in an individual, and we're going to be talking about that later. And limited access to high quality of care, significant differences of quality of care, but also delays. Next slide. In addition to the core exposure to factors such as trauma, there's been research that actually links tobacco use around 6 socioeconomic related disadvantages, which include unemployment, poverty, low education, disability, serious psychological distress, and heavy drinking. About 14% of individuals without any of these adversities smoke. However, with each added disadvantage, smoking rates increase, rising to 58% among people that have all 6 forms of adversity, which means the more adversities an individual faces, the more likely they are to start smoking and the less likely they are to quit. Next slide. Again, you can't talk about tobacco use without talking about cancer. And 40% of cancers diagnosed in the US have a link to tobacco use. And we know that this includes 18 different types of cancers as well. However, it's worth noting that mental health challenges affect persons in all stages of cancers, even those that have never smoked before, whether they have a pre-existing condition, maybe during treatment, while in remission, and often throughout their life course and into survivorship as well. So while the evidence still remains limited, it's been shown that up to 50% of patients with terminal cancer have been diagnosed with at least one psychiatric disorder. And individuals with a mental illness may develop cancer at 2.6 times higher rate on account of late stage diagnosis and inadequate treatment and screenings. Next slide. So is it a coincidence that both tobacco and cancer disparities exist for this population? No, and again, we can trace this back to the social determinants of mental health, which puts this population at higher risk of developing comorbidities. I also want to highlight that particularly with cancer, there's a huge financial burden that's placed on individuals, patients, and their families, and they might not be aware of financial resources that could be provided by community health and social service organizations, many of those that you all are representing right now. Next slide. So we know that a syndemic involves comorbidities and the social determinants of health, which cause interrelated problems, but it's also important to note that the environmental context and the political factors also contribute to these larger issues. Environment has a large impact on mental health, and this doesn't just refer to physical and built environments. There are other types of environment, and those include home environment, such as family dynamics or parenting style. For many Asian Americans, family dynamics may look very different, especially for immigrant or refugee families. Social environment, so has this person experienced trauma or harassment? We know, just as we heard from the discussion, these things are particularly on the rise due to hate crimes that have been exacerbated by COVID-19. Digital environments, which affects online comparisons to peers, self-confidence, and image, and even a person's sleep. And lastly, socioeconomic environment, which ties to things like poverty and political atmosphere. Next slide. Next up, we have the political determinants of health. The political determinants of health involve the systematic process of structuring relationships, distributing resources, and administering power, operating simultaneously in ways that mutually enforce or influence one another to shape opportunities that either advance health equity or exacerbate health inequities. We see the political determinants at play in tobacco control, particularly around distribution of power and money, and also policy development. So think about factors such as how much money a state tobacco control program receives to provide funding for their local communities, or tobacco product regulation, and also smoke-free air laws. Next slide. Local legislation in particular is important for policies that mental health and substance use facilities are enforcing when it comes to tobacco use services. So things like tobacco use screening, counseling, provision of nicotine replacement therapy and cessation medications, and tobacco-free grounds. We know that less than 50% of mental health facilities are providing cessation counseling, and the provision of nicotine replacement therapy and cessation aids are less than 40% across all facilities. And there's only 55% of mental health facilities and 36% of substance use facilities that are tobacco-free. So you see that there's this huge opportunity here to work with behavioral health providers who are usually tapped with addressing the primary concern of diagnosing and treating individuals, but addressing the issue more holistically by focusing on increasing evidence-based interventions, and policy as a whole can actually lead to better outcomes. Next slide. Now that we've gone over the social, environmental, and political determinants which contribute to tobacco and cancer disparity, let's talk about why people start smoking in this first place. So in particular, I want to draw your attention to trauma and stress, which unfortunately impacts a lot of individuals even before they start smoking. And feel free in the chat box to add on to this list. Next slide. Starting with the prevalence of trauma in the general population, Studies done in the last decade indicate that trauma exposure is actually quite common, even in the middle class. So 56% of the general population report experiencing at least one traumatic event in a study done by Kessler in 1995. A more recent global study conducted in 2016 of 24 different countries showed that more than 70% of participants experienced trauma. And that's a huge number. So experiencing mental health challenges is a natural response to trauma. And 76% of the adults that have experienced trauma will have at least one mental health or substance use challenge in their lifetime. Oftentimes we don't have conversations around trauma and tobacco use and tobacco control. And it's important to create this shift since a huge percentage of our communities, as you see, have been impacted by this. Next slide. I mentioned the impact of childhood trauma earlier, also referred to as adverse childhood events or ACEs. ACEs are potentially traumatic events that occur in childhood, for example, experiencing violence, abuse, or neglect, witnessing community violence, or having a family member attempt or die by suicide. ACEs are pretty common. About 60% of adults surveyed across 25 states reported that they had experienced at least one type of ACE before age 18. And nearly 1 in 6 reported they had experienced 4 or more types of ACEs. Studies have shown that ACEs affects everything from early initiation of drugs to obesity and even education, occupation, and income. Preventing ACEs could also reduce many health conditions. So for example, by preventing ACEs, up to 1.9 million heart disease cases and 21 million depression cases could be potentially avoided every year. Next slide. This chart helps us understand a dose-response relationship between ACEs and smoking. So if you can imagine 100 people who are all ACEs-free, they've never experienced an event, 6 of them smoke. You can think of this as the people who will smoke whether or not there are adverse events in the world. Their smoking may be caused by genetics or access to cigarettes, or by learning to smoke because the adults around them smoke. There are also people who tend to quit when given information about the dangers of smoking. Now imagine 100 people who each had 3 ACEs. Next graph. "11 of these individuals smoke. As you can see, the risk of smoking increases with ACEs. Now imagine 100 people with 7 ACEs. So they've experienced 7 of these events in their lifetime. Next graph. 17 of these individuals smoke. So the risk accumulates as the ACE score increases. The portion of smoking that is due to ACEs is tied to this change in risk. And as we know, smoking is responsible for almost 500,000 deaths each year in the United States, including 30% of all cancer deaths and 80% of all deaths from heart disease and COPD. Next slide. Moving on, we'll talk about stress. Before we dive in, I just want to note that all of us experience stress in our daily lives to some degree, and we function perfectly fine. But there are consequences of chronic stress. So what is stress? Stress is the biological response a person has to a challenge or a threat, also known as stressors. Cortisol, the primary stress hormone, increases sugars in the bloodstream. It enhances your brain's use of that sugar and increases the availability of substances that repair tissues in your body. It's important to note that cortisol performs many essential functions, and every cell in the body has receptors for cortisol, and cortisol influences many aspects of functioning for the cells. However, chronic stress puts our hormonal systems into overdrive, causing adverse effects with physical and psychological symptoms. Next slide. On the topic of stress and biochemical receptors, one of the reasons why smoking is so addictive is because the effect of nicotine on our brain and perceived stress and happiness. When a person smokes, nicotine reaches the brain in only about 10 seconds. At first, nicotine improves mood and concentration, decreases anger and stress, relaxes the muscles, reduces appetite. So it feels really good for the person. And regular doses of nicotine leads to changes in the brain, which then lead to nicotine withdrawal symptoms when the supply of nicotine decreases. So it's actually not feasible for a lot of people to go cold turkey because they will relapse. So smoking temporarily reduces withdrawal symptoms when they start smoking, and so, which is why they have a habit to continue the smoking. Next slide. When it comes to tobacco use and individuals with mental health or substance use challenges, there are many, many myths, but let's talk about the facts. The good news is that the majority of people with mental health and substance use challenges want to quit smoking and are more than twice as likely to quit with the proper treatment and counseling services. So definitely take advantage of those in the community, especially the Quit Line, which provides counseling as well. Smoking cessation can also enhance long-term recovery for persons with comorbidities using multiple substances. Next slide. Okay, we can't talk about stress without talking about COVID-19 and the massive amounts of stress it's put on everybody, regardless of the status of their mental health before COVID. So COVID-19 saw a rise in anxiety, depression, and other mental health challenges for the average person, with more than 54% of adults reporting that the pandemic had a negative effect on their mental health, and 26% of adults saying that they've experienced major impact. Unfortunately, more than 2/3 of people experiencing such impact rely on tobacco and nicotine as a coping mechanism, as we discussed earlier. On the other hand, we know that there's evidence on the link between tobacco and COVID-19, which also created this opportunity for individuals to quit smoking and protect their lung health in the face of a lung impacting virus. So what does the data tell us? More than 2/3 of people rely on tobacco and nicotine as their main tool to manage stress and anxiety. Cigarette sales also increased 1% during 2020 compared to 2019. And it's no surprise that alcohol sales and co-substance use was on the rise as well. In 2019, just under 1/3 of Quitline callers were Medicaid enrollees, and nearly half of them reported co-occurring behavioral health conditions such as depression or addiction. But at the same time, NAQC reported that Quitline calls decreased to an all-time low since 2007. We also saw dramatic shifts in access to healthcare, but also to our traditional support systems. There are disruptions to mental health services, with many facilities shutting their door, social isolation, which resulted in the loss of support systems. And there was even stress from seeing family members because you don't want to risk spreading COVID to them. So there's this also, last but not least, like this economic strain that happened from the pandemic recession, which left many people facing housing and food insecurity as well. And these factors all combined to create this endemic. Next slide. So we are facing multiple public health crises, that of COVID-19 and also that of addiction, and they will intersect. So we're seeing reduced access to EMTs, emergency departments, and hospitals because of COVID. People who use drugs and people in recovery from substance use challenges are also more susceptible to COVID because they're at higher risk of complications. They may have comorbidities and a compromised immune system. There's also a lot of pre-existing conditions and comorbidities that need additional support that the person might not have right now because of decreased services. With extended stay-at-home policies and economic downturn, we can expect to see that depression, anxiety, and substance use and relapse is on the rise as well. Many times with people that might not necessarily have had a mental health challenge before the pandemic. Next slide. You all probably know by now that CDC added smoking to associated illness in the severe high-risk group for COVID-19. Adults of any age with the following conditions are at increased risk of COVID-19, and this includes people who smoke and also individuals who have cancer. We see these other smoking-related illnesses listed here, such as diabetes, heart conditions, COPD, which again are all interconnected. Next slide. Here, looking at the comorbidities associated with smoking and COVID-19, we know that smoking doubles your risk of developing respiratory infections. And when taking into consideration of COVID-19, smoking doubles your risk of getting sicker. So while this is in reference to smoking in general, in the general population, when we think about the disparity among the individuals in the behavioral health population, it is significantly high end. And some of the reasons why this is that makes this population in particular at risk is because of the hand-to-mouth action of smoking. So you're more likely to spread germs. and other behaviors like smoking in groups or in close proximity to designated smoking areas. Even, some facilities, like I mentioned, only 50% of facilities had smoke-free areas. So for the other half, they still have those areas where you can smoke. Sharing of cigarettes and vapes collectively, or even by collecting buds. And we know that people who smoke may also go out to buy more tobacco products and be in overcrowded or unstable housing that makes it difficult to socially distance. So the latter is especially true for individuals with mental health conditions that also may be homeless. Next slide. During this time, it's crucial that we clearly communicate that smoking increases the severity of COVID-19 and emphasize that the adverse health effects of smoking and COVID-19 are well documented. Smoking harms nearly every organ in the body, and this is also the best time to quit. So quitting is beneficial at any age, and last but not least, clear air, free of any secondhand smoke and aerosols, are the best way to protect our communities and promote healthy lungs. Next slide. So to recap our main takeaways, individuals with mental health and substance use conditions use tobacco at a disproportionately higher rate than the general population. They are less likely to stop smoking without such conditions, but many people with mental health and substance use conditions want to quit smoking. We know what works as well, so using those tried and true proven interventions can help reduce tobacco use among this population. Next slide. Some of the ways that you all can help is by going back to your communities, advocating for the adoption of tobacco-free campuses. And this doesn't just have to be healthcare facilities, it could also be in your CBO, calling for an increased integrated health, finding ways to provide free or reduced cost NRTs. And we know from Ms. Eng that this is provided by the quit line for those that qualify as well. Passing along even just the quit line cards, championing, being a champion yourself, but also championing peer voices of people that might have smoked and quit, and using a trauma-informed approach when talking to family and friends about their smoking habits. And then the last thing is to think about beyond cessation and also about recovery. So even quitting one cigarette is still progress for the person. Next slide. On screen, we have some of the action steps for supporting a trauma-informed approach. So I talked at length about the importance of, the link between trauma and tobacco. And it's all really about building safety, security, trust, and compassion for individuals who smoke and are experiencing a mental health challenge. You'll be able to find more resources on our website as well. Next slide. So thank you all so much. I know that was a lot of information, but you can digest this information, come back for more by visiting and engaging with our network. Please visit www.bhtochange.org to join the network for free and gain more helpful resources and information. I'll now pass the mic back over to Michelle.
Great. Thank you for really highlighting all of the important factors that really go into syndemic when related to mental health. So at this time, I'd like to actually pass to Stacy, who's going to talk about the physical health pieces of nutrition and diet. Okay.
Aloha, everybody. Happy morning, happy afternoon. It might be getting to afternoon for some of you. Thank you so much for having me here so that I can share our community piece of our organization here. Next slide. Malama Oiwi is a 501c3 nonprofit. It is the native Hawaiian healthcare system for Hawaii Island, and it provides medical, behavioral health, and community education with the sole objective of improving access to quality healthcare, education, and services for the people of Hawaii Island. And it's dedicated to improving the health and well-being of Hawaii Island so all residents can live longer and feel better. Next slide. Oh, next slide. Next. All right, so these are some of the services. There's the family medicine clinic that came up, our education classes that are on Zoom, our community health workers out in the community providing education, and our specialty transportation, which helps to get people to their doctors. So all these services were going on during the pandemic to help our community. Next slide. And one of the other programs we have is the traditional Hawaiian healing. So this is their la'au lapa'au, which is plant medicine. Next slide. All right, so we're going to talk about creating sustained health behaviors through building capacities, strategies, and resources, and engaging youth-led tobacco control efforts. Next. And the big elephant in the room, which I know we've all been talking about, is the pandemic. The pandemic hit, right, affecting our services. Next. And as an organization, we looked at micro, which is us, Malama, how it's affecting us, right? It's affecting maybe income and revenue generation, and that's how we support our programs and our staffing, and we had to work remotely. So we looked at us, but then we had to look at the macro for our island and how we were going to help to continue services for our island. Next slide. And as other presenters have discussed, those socioeconomic challenges that impacted our community. So there were people who lost jobs, businesses had to decrease hours, many businesses have closed permanently. The vaccination policy affected people's employment and even where they could get services, so if they didn't have vaccines. People had to be quarantined at home. So again, the loss of income, the loss of socialization, the loss of social support. Some had little to none. Kupuna is our older generation and living alone, and then the fear of getting COVID. So there was a lot of fear and hesitancy, which impacted that social support and our mental health. We saw rates of domestic violence increase, child abuse, because of now the families are in the home with less income and resources were scarce. They're impacted our cost of living, right? In Hawaii, there is a rent moratorium so that people who lost their jobs or had decrease in income, they couldn't get kicked out or removed from the house. That ended June 1st of 2020. So we still have this added mental health, which is affecting our lifestyle behaviors. Food prices increase, gas prices increase, our electric bills increasing. Crime rates have been up significantly. We have shipping challenges here, right? We live on an island, so our supplies are impacted. So people have a tendency to hoard, or they're rationing, and then the limited amount of supplies that came in at time with toiletries, and then even later affecting computer supplies and cars and parts, just getting items to the island became more expensive and more difficult. Next slide. Life became all about Zoom meetings. Welcome to our Zoom webinar. There are so many advantages, but initially there were some disadvantage as a community organization trying to provide services. Our organization does service a large amount of Native Hawaiian Pacific Islanders who live in rural communities, and also tend to be, or a larger portion is over the age of 50, and even more over the age of 80 or 75, 80. So using technology was very challenging and very frustrating. And it was important for us to continue to provide our services and get used to that Zoom world, or the virtual world. So we had to do a lot of hand-holding with community and individuals to help get them on, to get them comfortable, to get the families access to services in their home, which families had to start doing it because schools were also shut down for a little while. And we still have some schools, I'm sure, as you all across the nation, that are in virtual mode still. But yeah, initially it was really a challenge to get our kupuna, our community, used to using technology. And now we're more comfortable. We still have technology challenges. Things don't work all the time. And as a community, we still have limited access in some rural areas. So that has been something being addressed, but again, it is impacting education or those services that can be provided. Next slide. In our services, sustainability became our focus. Next slide. So for sustainability, while we are providing services, we often offer incentives for attending our classes. And those incentives can range from like foot care products for people with diabetes, or smoking cessation quit kits. For someone who has chronic disease, we promote those in our classes. But when the pandemic hit, we wanted to include more sustainability. Again, as an island, we knew our resources were limited. So if we could help people plant more food at home, we started giving plant seedlings as an incentive when they attended class. So even though we were in the pandemic, we had distribution sites where we would drive out and offer people to come by. We have our community health workers where if they needed to go to individuals' homes to drop off those incentives, they would do it. And so besides the plants, we did cloth napkins, we did bamboo cutlery, and we have our Cancer Kind home kit, which teaches how to make cleaning and hand sanitizer from simpler products that would, again, reduce that cancer risk. Next slide. Opportunities. So many opportunities have been happening during the pandemic. I'm sure you guys are all still having more opportunities. Next slide. COVID money, right? So there are many opportunities to have funds to help get those education resources out there. So here is like our job listing. This is active, this is today's, and there's community health worker on here, 2 positions, 2 outreach worker positions, a psychiatrist, because again, knowing that mental health was a huge challenge in having services, our island is very limited on psychiatry. So we have a position for a psychiatrist and then 2 transportation positions. All those jobs that I mentioned have been posted on our website, and we've been actively recruiting for over a year. So even though we have these monies, we have these opportunities, it has been very difficult to get employees. For some, unemployment was at a higher rate. So it was actually a benefit for them to stay home and receive unemployment versus getting employed again. Those extra benefits have ended, although because of the concerns with the pandemic and fear of virus, we have a higher rate of those who haven't gotten vaccinated. So people are still continuing to stay indoors as much as they can. And so it's really impacted our job market here. And again, I'm sure many of you might have had the same concerns. Next slide. Food hubs. Food hubs was one of the first things that came through our organization, where we could work with other community members to identify keiki and kupuna who are most vulnerable in receiving food. And we tried really hard to look at foods that were had antioxidants, things that would boost your immune system because of the COVID virus, and as well as having population with higher rates of chronic disease, especially in our elderly. So our farms were severely impacted, right? Because our farmers here depended on hotels and the travel industry for a lot of their agriculture products. So when tourism was greatly affected because of the pandemic, all the farmers got together and were able to use their product with these food hubs. And there are 17 food hubs throughout our island. So it wasn't just our organization, but it was a number of organizations with these food hubs. And besides the food hubs, a lot of the organizations have really come together. So that's been one of the benefits, that the organizations are really coming together, not duplicating services, and really trying to address the most vulnerable while providing the COVID education. And in our education, we try to supply as much resources as we can for tobacco cessation, but also vaping. Next slide. Native Hawaiian Pacific Islanders. So we have a higher rate of the vaccine hesitancy. And in our community health workers' work, what they find is it tends to be misinformation about the vaccine and how it might help. So during our efforts, really providing that education became important. But again, because we were limiting contact, social distancing, it was more difficult to provide that education to everyone. But Native Hawaiian Pacific Islanders had a higher rate of negative impacts from COVID and the health implications. And then there were the higher rates of chronic disease and having multiple chronic disease in that population. Next slide. Oh, here's the video.
Aloha mai kako. I am Auntie Edna with Oiwi. Though times are changing, we are still here to take care of our Hawaii island. Join us for our free online
Here's our classes online.
Health education classes. Connect with our community health workers located around the island. Visit our website at hmono.org. Heli mai, connect with us and tell them Auntie Edna sent you.
Auntie Edna is one of our kupuna. She was the foundation of our health education department. And because of her health, her own personal health concerns, she needed to stay home. So she had that social isolation and unfortunately passed away last year during COVID. Okay, so our distribution, Malama Keola, this is where we distributed 500 bags to 5 of the major districts on our island. And we did that 3 months in a row to help our community. And in those education kits, we provided tools to boost your immune system, self-care tools, emergency supplies. Next slide. Again, it took a village to help take care of community, and it's really brought us together. So this was just some of the people. Next slide. Pods, and more pods. I'm not sure if you guys are experiencing that, but it gave us that opportunity to get out, provide support, education, and see what our community needed and how we could help out during that time. Next slide. Again, our mission is to uplift the health of the Hawaiian nation. Next slide. Thank you very much for giving me an opportunity to share with you guys about our community.
Great. Thank you, Stacy, for highlighting some of the initiatives that you guys do in the community for physical health and wellness, as well as the nutrition piece. It's actually super important to really pay attention to those pieces, because when we look at things like food insecurity and also just being indoors all the time during COVID, that's something that we really need to think about, and how that really ties into the mental health aspects, and what sort of coping mechanisms really turn to, whether that be, healthy things like actually getting out and doing things, or spending time with family as much as you can do so, within something like a pandemic, or, how do we choose options that are just, much better for us in terms of healthy eating, and how do we even do active living when, a good amount of time for the last 2 years was actually, there was no in-person interactions at the gym or anything else. And then how do you really, make sure that you're able to continue to have a stable sort of outlook, and don't really become, so just, getting very down from being indoors all the time and not being able to actually see your friends, your family, and do normal things that you do on an everyday basis. But then also, you know, really thinking about the chronic issues that can really develop from this as well. Obviously, with you know, problems with food insecurity, we can think about unhealthy eating, fast food, or whatever it is that you're able to just kind of get a hold of. And a lot of times those things, you know, lack nutrition and are just bad for you. And then, you know, down the line, you'll develop things like cardiovascular disease, obesity, and you're going to see a lot of that. Like, you know, we don't even know what the effects and impact that's really going to have on our youth in the future. We've had an entire 2 years of having kids, adolescents, and even adults just inside, away from people. There's lack of social connections. How do we really rebuild the education pieces that they're missing and that outlook? So, you know, now we have Alexandra Parks, who's going to really highlight some of the pieces that we can really look at from, you know, actually backing away from poor coping mechanisms like tobacco, and looking at like really looking at youth engagement and leaders of the future. So I have Ms. Parks here.
Great, thank you so much, Michelle, for the introduction, and thank you for inviting me to be part of this webinar. Very excited, and thank you to all the presenters. Super helpful information and some great work being done. So I'm super excited to be here this afternoon or morning for some of you all to really be able to present some youth-centered resources and opportunities for young people to become engaged in tobacco prevention, advocacy, activism around either their communities or school campuses. So again, very, very happy to be here to present these resources. Next slide. So I am from the Truth Initiative, and for you all who may not be aware who we are the largest nonprofit public health organization dedicated to a future where tobacco and nicotine addiction are a thing of the past. We do this through several ways. We seek, speak, and spread the truth about smoking, vaping, and nicotine. We do this through our education, public education campaign, which is our Truth campaign. But we also have a very robust tobacco control research and policy programming. We have our community and youth engagement, which is where I sit in, and we also offer digital cessation programs as well. Next slide. Our mission is very simple and straightforward. We are achieving a culture where young people reject smoking, vaping, and nicotine. Next slide. As I mentioned earlier, we do have our public education campaign, which is our Truth campaign. And this campaign really is distinguished because it is really youth-led. It is youth-centered. It is resonates with youth using approachable, clever messaging. It does not condescend youth in any way or preach to youth or finger wag to youth. But it really just resonates to what messaging youth feel passionate about as it relates to prevention around smoking or vaping nicotine. So what we really try to do is provide messaging and facts so that youth and young people are then informed and can make informed decisions. Next slide. So back, we were interested, given the whole COVID situation that everybody experienced in, we did a survey among young people where we listed several public issues and causes and wanted to know how important each of these were to youth. And as you can see from the survey, mental health issues raised to the top, with 74% of our young people saying that this was important, along with obviously suicide prevention. And then also more than half, close to almost 60%, vape use among young people was also an issue that they found important. Next slide. with this information and what we had been hearing, before COVID, is that vaping was really an issue among youth. We had made a lot of progress with decreasing the smoking prevalence among young people. But when vaping really came into the picture, we saw that the rates were beginning to spike up tremendously and very fast. I think pre-COVID, around 2019, the rates in high school were up to close to almost 20%, back to where we were with cigarettes. And so knew that it was our responsibility and there was a need to create a curriculum to be able to provide to schools, high schools and middle schools, around vaping prevention, but also provide cessation. Next slide. So again, the need was, again, pre-COVID, 19.6, 1 in 5 schools students were vaping, approximately 15.3 million high school students across the country. Obviously, we weren't the first organization to create a curriculum. We do have several other organizations who have curriculums, but there were reaching about 1 million high school students. So about 14 million were not being reached. So obviously wanted to create a resource that would, increase the reach of high schoolers. We also did a survey regarding what would be a curriculum that is needed out there, and the #1 requested curriculum for educators, they were looking for a vaping prevention. Next slide. So since we weren't the only ones, we wanted to make sure that we really differentiated from others, and what would we put out there that was different from others. And so what we really wanted to do was to make this curriculum that would be self-led, that was interactive, that was coming from the Truth brand, which is really the model that we use as a peer-to-peer perspective. We wanted it to have a cool factor. We wanted it to be evidence-based, just like all of our programs are, but also include a very robust evaluation so that we would be able to track knowledge gains, shifts in attitude and belief as well. But more importantly, what we did want to include is also a resource for those students who were already vaping and were interested in information about how to quit or how to even think about quitting. Next slide. So with that, we created our Vaping Know the Truth, which is a free curriculum to all high schools and middle schools. It is 4 lessons. It was created with us and Kaiser Permanente, who actually funded this curriculum, in collaboration with the American Heart Association, and delivered by Everfi, which is a digital education platform. The curriculum, like I said, is in 4 lessons. Each lesson is about 5 to 8 minutes long. There is a pre-assessment in each of the lesson plans, so that again, we were able to track if there is gains in knowledge, shifts in attitudes and beliefs. There is interactive components. There are different media elements that are used. There are fun games that are included. And that the curriculum can also be taken over any mobile device phone. So this is Android or Apple. And here are the lesson topics around dangers of vaping, the addiction and nicotine, again, refusal skills and resources to quit. I do want to say that our last module in this curriculum is really focused on self-care. We had heard that, obviously during COVID, this curriculum actually launched on November 2020. So it was right around when COVID had hit us just a few months back. But we had been hearing all about how young people were dealing with mental health and all the stressors that were coming with this. So we wanted to make sure that we included some self-care tactics and ways that young people could deal with stresses without turning over to vaping. So we do have a lot of information around self-care and mental health in our Module 4 curriculum. The curriculum is aligned with the National Health Education Standard. For those who may be interested, who may be interested in implementing what are the standards that it aligns with. Next slide, please. And actually here is a quick minute video describing, and you can actually see the curriculum itself in the works. So here you go.
Today, 1 in 5 high school students are vaping e-cigarettes. The Surgeon General has declared it an epidemic. Now Truth Initiative, the nonprofit behind the nationally recognized Tobacco Prevention and Education Truth Campaign, has created Vaping Know the Truth, a first of its kind digital learning curriculum available free to schools nationwide. It's prevention focused to keep students from starting. And for those who are already vaping, the curriculum links directly to This Is Quitting, the only proven effective text message program designed specifically for youth and young adults that is already helping hundreds of thousands on their journey to quit vaping. Whether in class or at home, students will complete 4 self-paced lessons. Students will learn the facts about e-cigarettes, the history of tobacco companies' manipulative marketing tactics, the dangers of nicotine addiction, and keys to self-care and quitting. Just as important as what students learn is the unique way they'll learn it. Vaping Know the Truth deploys peer-to-peer video, engaging quizzes, and a format that allows students to go at their own pace, and is delivered in Truth's authentic youth voice. The program was developed together with Kaiser Permanente and EverFi, and in collaboration with the American Heart Association, trusted voices in youth education and health. Vaping Know the Truth is already helping students across the country. Youth vaping is a problem, but we have a solution. Working together, we'll make smoking, vaping, and nicotine a thing of the past.
Great, thank you. Next slide. So it's been almost 2 years with launching the curriculum, Vaping Know the Truth, and we have been doing a lot of evaluation around students' perceptions, teachers' feedback, and happy to share that overwhelmingly, we're hearing that students, the information is increasing their awareness of the risks of vaping, and that they are prepared to make informed decisions about their health. I think one of the aspects that they really like about this curriculum is that they get to hear real stories from youth who actually vaped and their experience with quitting, and also learn more about how to deal with stressors and information related to how the vaping industry has also targeted youth and why this is an issue for them. Next. But we've also been hearing about teachers. Teachers agree that this course was easy to fit into the curriculum when everyone, had to be taken away from in-person learning into remote learning. Teachers were hungry for curriculums, online curriculums that they could do in class, with their students. And so this came really in an opportune time. Right now, I know that there is, a lot of schools have gone back to in-person, which unfortunately we're beginning to see that there's been an uptick on vaping now, because as you all know, vaping among young people has really become a social thing. And so we are really beginning to see that vaping is now back to, getting back to those dangerous levels that they were in before. The teachers are also saying that it enhances their current classroom curriculum. So we are mostly seeing that the type of teachers who are doing this is obviously an array of teachers, mostly from PE, health, counselors, but we also have history teachers implementing this curriculum in their classrooms, because we touch upon the history of tobacco, the history of the marketing around. So we have some business classes that are implementing, but we also have different teachers who have used maybe just one module and not the entire curriculum, which is the flexibility to do that as well. So very happy to hear that, the teachers are finding this super helpful in their classrooms. Next slide. So if you're wondering how you can have access to this curriculum, again, this is a free curriculum. If you go to our Truth Initiative website, or if you want to go directly to truthinitiative.org/curriculum, we have a dedicated webpage on the Vaping Know the Truth curriculum. There you will access to the video that we just saw. If you want a one-page overview of the curriculum to share with your community-based organizations, your schools, if you have connections with principals or teachers or school district leaders, you're able to print that out. You're able to get a real overview of each module. Or if you are already sold and just want to go ahead and sign up for the curriculum as an educator, you can just scroll to the bottom and you can sign up with EverFi, and you'll be able to have access to the curriculum. Now, this is a school-based curriculum. I do want to say that. And so there has to be a connection to the school. However, if you are a community-based organization or an after-school program and are interested in potentially implementing this with your youth, we do have an opportunity to be able to do that. So please reach out to me at aparks@truthinitiative.org, or Michelle might be able to send our contact information. And we do have opportunity to do that as well, where you're able to implement this too. Next slide. All right, so as you might have heard, you will, I've mentioned This Is Quitting, and This Is Quitting is our text message program designed specifically for teens and young adults to quit vaping. Next slide. So This Is Quitting is confidential. It is available 24/7. This Is Quitting is specifically for those young people who are interested in quitting vaping. I think the unique thing about this is that it's very discreet. So if you are a young person who's maybe your parents don't know that you're vaping, this is not an app, this is just a text message program where you can then discreetly reach out to them, and then they will ask you for your name and your age, and based on that, you will be then put into a different subgroup, because there will be different messaging if you are from the age between 13 and 17 versus if you are from 18 to 24. Then you will be able to receive text around if you're ready to set a quit date, if you're interested in quitting. If so, then you were able to provide with daily texts messaging if you are able to set a quit date over the next 12 weeks. If you're not ready, then you can enter different keywords like stress or triggers, and they will provide information around that. I think the very unique part of this is that a lot of the text messages have actually been created by young people as well, so it resonates with them. Next slide. So here is, since the program launched in January of 2019, we have about 445,000 young people who have enrolled in This Is Quitting. And here you can see the breakdown of how many teens and how many young adults. And so obviously there is a tremendous need and really a tremendous ask for information on how to quit. Young people want to, but they just may not know how to. And so again, this is a very useful resources for all. We see that the engagement, about 62% of those who are enrolling are setting a quit date, and 67% actually complete a full program. So again, free resource, This Is Quitting. How do you access it? Next slide. If you are a young person and you are interested in potentially quitting or just get information on quitting, all you have to do is text Ditch Vape to 88709. If you are a parent and are interested in receiving messaging for parents of vapers, you can then text QUIT, Q-U-I-T, to 847-278-9715, and then you will be enrolled in a text message programming, but to support your child in their journey to quit. So again, that there is also something available for adults who may want to support young people in quitting. If you are an organization or a community-based partner organization who is interested in working together with This Is Quitting and customizing some of their resources or materials to promote them within your community, please email tiqhelp@truthinitiative.org, and we can then discuss with you ways to co-brand, or specifically if you want to be able to customize this program as well. You can also receive free promotional materials like posters and palm cards and quick cards that you can pass out to your community too. Next slide. Oh, I just got a 3-minute warning, so I'm going to do these very quickly. Youth activism. Next slide. So I do want to talk about opportunities that we have on empowering young people. You know, part of our work that we do here at Truth Initiative is to develop young people to become leaders. And so we provide them with skills and resources that it's needed for them to become leaders in their communities. And we do this through several programs, one of them being our ambassador program and our experiential and mobilization program. Next slide. So our ambassador program is a year-long program. It's a paid leadership program where young people can join a small cohort to get training, to work on specific projects that they may be interested in, to advocate for change in their campuses, in their community around tobacco and vape-free policies. They're also able to share their stories with decision makers. We'll be able to train them on communication, storytelling around different issues. So if you know of anyone that is between the ages of 18 and 26 who may be interested in this ambassador program, please visit this website that's here in the link. We are accepting applications on a rolling basis right now. So would love for you all to go ahead and share this with your youth networks. Next slide. We also have our experiential learning and mobilization program, and these are actually alumni from our ambassador programs. And these are our youth and young people who are young adults who are trained to become facilitators so that they can do presentations, webinars, in-person trainings with young people. We know that peer-to-peer education is an important element. I myself have a teenager. I can tell him one thing over and over, it'll go in one ear, out the other. But if his friend or someone his age tells him the same thing, he will definitely listen more. So again, this is an opportunity. If you are part of a school, part of a community-based program, and would like a presentation on different topics and would like a young person to come, please visit our website here. You can fill out a form regarding your training request or presentation request, and we'd be happy to help you with that as well. Next slide. We also have our activism campaigns, which are really focused on how tobacco and nicotine interrelate with different areas that youth have pointed out are important and passion points for them, including mental health, the environment, and social justice. Our goal for all of these is to really get decision makers to take action, to get the FDA to remove all flavored and vape products, and for our environment piece is really for the National Park Service to implement tobacco and smoke-free policies at national parks. Next slide. This is just a quick link to what I have said. You can, if you want to go, if you're a young person wanting to get more involved in our campaigns, here are the direct links. Or if you are a person and just want to be able to directly text ACTION, ACTION, to 88709, and you can get enrolled and how you can become not only take actions both digitally, but also do on the ground work as well. Next slide. Quickly, I do want to do a quick plug. We'll be hosting a youth menthol convening. We all know that menthol is a huge issue for many populations, especially our young populations, especially our populations, communities of color, priority populations. So we will be hosting a youth menthol convening September 27th to 30th this year. We are currently accepting applications. So if you are interested, please register. Here's the link below, or the QR code. We are accepting applications for any college student who may be interested in learning more about this issue and moving forward, and all expenses will be paid. You'll find more information on the registration. Registration does close on July 18th, so again, please feel free. I will send over more information and resources for Michelle to share with everyone else. Next slide. I think I may have only 1 or 2 slides. Next slide, tobacco vape-free college program. So quickly, we do have a vape-free college program that's helped pass 145 policies across the country to get campuses to go smoke-free, tobacco-free. This has impacted more than 1.3 million students. We are very, very excited. This program has been launched in 2015, so we've been working on this for quite a bit. However, we are super excited. Next slide. To let you know that, we do have a college leader program that is part of the center of this grant program that we offer to colleges. So super excited again to have youth get involved with this programming to get their campuses to go smoke free. Next slide. But the exciting part is that we are launching a new grant opportunity. So if you work in a college, and if your college does not have a 100% smoke-free tobacco policy, tobacco-free, we are giving up to $20,000 to work with your campus, work with your college to go 100% tobacco-free, smoke-free. The request for proposals will be launching June 22nd. And applications are not due till October. So please, please, please go to truthinitiative.org around sometime next week, and you will find access to this new grant opportunity for colleges. Next slide. Oh, that is it. I think I wrapped up in a minute. Tons of information. Sorry I had to rush a little bit, but happy to share with Michelle some of the resources and links and so forth if she'll be sending something out to all attendees. And I hope this information was helpful to everybody. Thank you.
Thank you, Alex. Appreciate your presentation there on all the youth initiatives that you can really do to go for anti-tobacco. I appreciate everyone who joined us in on this call and stayed the entire time. I know we went over by about 2 minutes. I wanted to actually go ahead and say Ms. Linda Bosma will be sending you, or actually Dr. Linda Bosma will be sending you a survey for the post-webinar pieces. Please keep a lookout for that. And then I'd like to ask one last question if no one else has anything to ask our panelists. So what I'll actually propose is, after hearing all of the different presentations today, what are some takeaways that you think are important for us to keep in mind for all the social determinants that really affect tobacco, chronic disease, and health? I'll pass to any one of our panelists who would like to actually speak and give last pieces.
I can share that a little bit. Thank you again for all these great presentations. To me, the great message that I have learned, it's actually we have to reaching out to the populations, no matter which populations that we are working with, it's youth or people that they're struggling with other types of health issues, behavioral health, mental health, or physical health. So for a lot of the populations that we are serving, they really need someone to actively approaching them and to listen to what they need, and also identify people that among their communities that can connect with them to help them, or we actually helping each other to grow and to be better. So that's how I, summarize what I have learned from today's webinar.
Thank you, Sherry.
Just building off of Sherry's comment, I would say that, we do definitely need systemic changes to happen in order to reduce these disparities. But all of you have the power to make a difference, whether it's through your community-based organization or even as an individual. So taking even the first step to talk to family, friends, and neighbors about tobacco use or passing along a quick card, that could make a really big difference in the lives of other people.
Thank you. Yeah, and so, after seeing all of our presentations today, I'd really like to say, the commonality is looking at how we can really reduce the impact of what the social determinants really have on our mental health, our physical well-being, and how we really, choose to cope with, different issues, whether that be COVID, food insecurity, mental health, all of these things. There's like a clear line that you can kind of see. Also trauma, structural racism, all of that actually really impacts how we as individuals, continue with our health and wellness. And I think it's important to really seek out the community engagement and community leaders to really look at policies to work on actually making these things better for our communities. All right, and with that, I would like to close the webinar, and I appreciate everyone for joining us and all of their time. Thank you.